Hello everyone, I am Dr. Akhila, consultant obstetrician and gynecologist. Many women with abdominal pain, chronic pelvic pain, abnormal vaginal bleeding, heavy menstrual bleeding, pain during periods, unfortunately still suffer in silence. Some because of misconception that they have to live with that pain, and because being a woman, they have to suffer these problems in their menstrual cycle. Some with the misconception that if they meet a doctor, they may suggest surgery, or with misconception that there is no medications available, fear that the surgery will be involved and there are complications associated with the surgery. But nowadays, there are many conditions that the women suffer now. They can be treated with medications itself and surgery will not be required. Fortunately, with advances in technology and with the use of minimally invasive surgery, that is the laparoscopic surgeries, even complex gynecological surgeries, as well as early stage malignancies can be treated with this surgery itself. Welcome to BirthVibe by BirthRight by Rainbow Hospitals. Today we are going to talk about this topic, that is gynecological minimally invasive surgeries, and joining me today is our expert gynecological surgeon and laparoscopic surgeon, Dr. Rao Bahadur. Welcome, sir.
Good morning, madam. Yes.
To begin with, sir,
Yes.
What exactly is minimally invasive surgery and how does it differ from the conventional traditional open surgery?
Coming to conventional traditional open surgery, which has been going on for quite many centuries, it's actually opening the abdomen. Abdomen in the sense for common man to understand, it is stomach, what they usually call. So we open the abdomen in different layers, which is a bigger incision, roughly around 10 centimeters incision. So that has difficulties for the patient's recovery and blood loss. So all those things were there when the traditional conventional system was going on. So now with advancement of technology, advancement in surgical skills, we have developed something called as minimally invasive procedures. It has many systems under minimally invasive procedures. One of them is laparoscopy, where we put a small incisions on the abdominal wall and introduce telescopes and operating instruments into abdominal wall. Look at the TV, because the camera records which is introduced into the abdominal wall through a telescope, projects the picture onto the screen, and we look at the screen and we operate. So that is called as minimally invasive. So we minimally involve the abdominal wall incision. So that is one method. The other way, in the same way, is introducing the scope into the uterine cavity. So that is called as hysteroscopy. So the scope in the uterine cavity, which gynecology, the uterus is what we deal with. So it's called as hysteroscopy. In the same way, there are other departments which they also use such procedures. They called as cystoscopy, where they put the camera into the bladder. They put the camera through the throat into the esophagus, that is esophagoscopy, or through the rectum, there is rectoscopy. So there are different ways of doing it. So it's also done by other departments like orthopedicians, where there is arthroscopy. They put the camera into the joint. So this, and still advanced procedures which have evolved is robotic surgery. It's also in minimally invasive surgery.
Okay. And sir, with regard to post-op recovery and duration of stay in hospital, and with regard to the pain, how does this minimally invasive procedures differ from the open surgeries?
As I said, open surgery involves a bigger incision or bigger cut onto the skin. So definitely that will require multiple sutures and multiple suturing of the abdominal wall. And so it will be more painful. The patient has to be in the hospital for at least a minimum of 7 to 8 days for the scar to heal and for the stitches to be removed. In that 7 days, she'll be ambulating at a slower pace. She will not be moving she or he, whichever's a patient, male patient, if for a male, for their conditions, and for female patients. Now I'm dealing with the female patients, I'm a gynecologist, so I'll talk in that perspective. So they will take a longer time to move out and move ambulatory. So in minimally invasive surgery, since they are keyhole surgeries, it's just 5 mm incisions on the skin, so they will be less painful. And some of them don't require any suturing also, the scarless. So in that matter, this is much better outcome as compared to the conventional one.
Yeah, so there is less pain and recovery will be faster when compared to the conventional method. And sir, because of now many patients, because fortunately they do a lot of annual checkups done. So very small things like some fibroids, ovarian cysts are being picked up. But the woman absolutely doesn't have any problem. They don't have any symptoms. So do everything that is picked up in scan, do they require surgery?
Ma'am, if we do scan for 100 women at randomly at one given of point of time, around 60 to 70% will be having some element of fibroids in different sizes. All women don't require any medical treatment, nor surgical treatment. It is those women who have complaints or who have symptoms developing because of the fibroid. We are just taking one example of fibroid. The other example is ovarian cyst also. Not all ovarian cysts require surgery because there are something called as functional cyst. Every woman ovulates every month. That is, ovulate means the ova grows, it forms into a ovum, it releases and it dies off. If it doesn't, then it remains patent, it remains persistent there and forms a cyst. But over a period of time, nature has developed such a defense mechanism. Within 3 months or 4 months, it gets absorbed by itself. The body absorbs the cyst by itself. So those cysts, if detected, need not be operated. But if the cyst remains persistent or it undergoes some changes which requires treatment, then they require definitely some medical management or certain conditions, surgical management. In the same way, fibroids also.
When surgeries are being done for young women, especially unmarried and who have not yet conceived, it's very important to preserve their fertility. So does Birthright have these options to preserve fertility in these young women who are undergoing complex surgeries?
Yes, ma'am. Birthright definitely has the facility available. So what we can do is something called as retrieving the oocytes and preserving them. So at Birthright, these options are given to the patient, and whoever patients are undergoing surgery because of where they are certain that there is damage to the ovary, so they are counseled and advised to undergo oocyte preservations, which is definitely available at Birthright.
Yeah, because I think there is a infertility department.
Yes, we do have a full-fledged working infertility department.
Help can be taken.
Yeah, we can always take the help of the infertility specialist and go for surgery.
And how well is Birthright equipped to handle complex gynecological surgeries, sir?
Yeah, in Birthright, what we're having is we're having a comprehensive team. Like we have a equipped or OT, we have high-end instruments, and whether it is laparoscopy telescope or electrical surgical instruments, like for example, where we require fine dissection, we are having harmonic one instrument is there, which gives a better precision in operating and minimally damaging the surrounding tissue. So Birthright does have all these equipments. At the same time, Birthright has highly specialized anesthesists to handle this type of surgeries. So we also have other department ancillary help like for urologist and surgical gastroenterologist. So all the team is there, definitely it gives a good outcome. So
yeah.
Birthright does provide all this.
Though its name is Birthright by Rainbow Hospitals, we don't just deal with deliveries. We have facilities for dealing with complex gynecological surgeries. The equipment, the surgeon, the anesthetist, everyone is available.
Yes, available. It's not only the delivery part. It was started as a process of delivering, but we have slowly ventured into the gynecological processes also.
And sir, what advice do you give to women who fear to undergo these surgeries?
See, the fear was that whether these complex surgical procedures are available in the town or in their locality or in the city. But what I would like to tell the women who are undergoing such disorders is that nowadays the technology has evolved, and India has evolved in bringing those technologies into our country. So we definitely have skilled hospitals, skilled technicians, skilled surgeons. So they need not fear for the surgery outcome. They can approach the doctor. The doctor will decide whether what surgical procedure has to be performed and whether it is required or not. So first thing is approaching to the doctor and telling about your problems, and let the case get evaluated, and then they will come to a conclusion.
And finally, sir, are there any misconceptions associated with...
Yes, there are many misconceptions. The most common, madam, I come across is, sir, laparoscopy you're doing. What people understand, they don't understand laparoscopy, they say laser surgery is what the commonest word they use. So what they feel that is this disease will be completely cured because you're saying that I have such a big mass in the abdomen, and you're saying that I'm going to put some small few incisions and operate and I remove the mass. How the mass will come out? So that is the misconception, whether it will be completely done or no. So they feel that there will be some amount of disease which will be left inside, because the lack of trust between the patient and the medical fraternity. So which that requires a bit of counseling, telling them what is this procedure, how it is done, how we retrieve the disease organ out. So once they understand the technique, then they are comfortable in undergoing the surgery.
So not all things that are picked up in scan require treatment. Now coming to endometriosis, sir, now we are seeing a lot of young women, even unmarried, teenage girls coming with severe pain abdomen. Unfortunately, there is this misconception still going on that even some of professionals advising them that it is normal. They can wait with years, it will settle down. Some are being advised that after marriage it settles down. Some that after pregnancy and delivery it settles down. Is it true, sir, that endometriosis will decrease as the age of the person increases, or we need to do anything for that woman?
Ma'am, rightly as you said, endometriosis is now an evolving disease. It has been there in the past, but of recent it has been noted very frequently. Now, just to start to answer your question, I'll need to slightly make aware what is endometriosis. Now, how women menstruates, the endometrium within the uterine cavity comes out of the vaginal cavity. So that is what simple menses, what we call as. The same endometrium, if it is outside the uterus in the abdominal wall, either on the ovaries or within the myometrium, within the musculature of the uterus, it leads to bleeding every month, which occurs in a woman's life. So, but the bleeding which is occurring inside the uterine cavity has an excess outflow, so it comes out. But the bleeding which is occurring in the abdominal cavity or within the musculature, or if the endometrial patches are on any other organs like on the bladder, that is bladder which collects urine, or on the rectum which is the movement organ, there the bleeding will not have an excess outlet. So it remains there over a period of time, it collects and forms a small cyst. That is one aspect. The second thing is that every time when she bleeds, there's reaction in the abdominal cavity. So this reaction causes something called as scarring. So over a period of time, this scarring becomes a nodule. And there's a lot of nerve supply to these organs, the rectum, the bladder, the ovary, the peritoneum, the uterus. So these nerves also get damaged. So once they get damaged and this scarring is formed, there will be severe symptoms which they present. Like for example, they present with severe abdominal pain, either during menstruation or even though if they are not menstruating, because of scarring, they constantly have pain. And sometimes they have irregular cycles because of this endometriosis. So when such conditions are present, they require treatment. But as some of our professionals has been telling that this is an ongoing process, you have to live with it. It is not that we have to live with it. Whenever the symptoms are developing, the treatment is required. But as they were saying this, it is true that it is an ongoing process. It's called as benign malignant conditions. It remains in your body till the time you are menopausal, either by nature or the ovaries are removed, which is producing hormones for some surgical reasons. Only in those conditions, the endometriosis slightly decreases, flaring up, or it's a dormant stage. We jokingly say, the best way to treat endometriosis is the patient should be pregnant. Because 9 months of pregnancy plus 6 months of breastfeeding, she's not going to menstruate, the hormones are not going to act. So that's the time when the endometriosis settles down. It's a brief period. Once she starts menstruating, again the hormones are going to act. The pathology is going to advance.
Yeah. As rightly told by sir, endometriosis is a progressive disease. Unfortunately, it won't get better as a woman ages. And it is better if she is having problems like severe pain, it is better to take good professional help as soon as possible. Now coming to the next question, sir, is choosing the correct hospital and correct surgeon important when the woman opts for minimally invasive surgery?
Yeah, if you are saying minimally invasive surgery, and if endometriosis is as a condition, if we take, there are different stages of endometriosis, for example, stage 1, 2, 3 and 4. Now 2, 3 and 4 definitely will require advanced techniques, advanced surgical skills. Now minimally invasive surgery, the instrumentation, the OT setup, the anesthetic team workup is definitely required. So we require a specialized anesthetist who are trained in giving general anesthesia for longer duration, and surgeons also who are trained in using those equipments, laparoscopic equipments, and because the precision of surgery has to be very correct. So it requires a lot of training, lot of skill experience required. So definitely choosing the hospitals where such expert doctors are available is one important parameter the patient has to take into account.
Yeah. And sir, now virtually in every case we are doing by using minimally invasive technique. Are there any contraindications like in some patients where we cannot do this minimally invasive surgery?
Yeah, everything is not laparoscopy. There are certain things where laparoscopy cannot be used or cannot reach the access area. Now, for example, patient is medically unfit, like patient is having severe cardiac disease or severe thyroid disorder or lung disorder, because the patient is given general anesthesia. So if the lung disorders are there or the cardiac disorders are there, the heart cannot cope up with the anesthetic agents, or the lungs have to, the tidal volume, there's something called as tidal volume. The machine takes over the breathing of the heart, of the lungs. So if the lung is not able to expand to the fullest capacity, less oxygenation reaches to the tissue. So there will be hypoxia that can have a detrimental effect on the patient. So just because minimally invasive surgery is available and that is the option we have to choose, but at the cost of the life of the patient is not the right thing. So there are certain conditions. So sitting with your doctor, discussing your condition with the doctor will examine you, and if you are fit for the surgery, definitely they'll offer. If not, then they have to go for conventional method.
Yeah. And sir, is multidisciplinary unit required for laparoscopic surgeries?
Yes, madam. It is the requirement for laparoscopic surgery, because it is not one surgeon is the one who's performing, but there are many other people who are handling the patient's life. For example, we require a modular OT, which is fully equipped with anesthetic equipments as well as laparoscopic equipments. The anesthetists have to be aware of the complications which can occur while giving anesthesia, particularly for a laparoscopy, because this is a long surgery and the patient has to be totally under deep general anesthesia. At the same time, the nursing staff who's assisting also have to be well trained, because what equipment have to be given, she or the male nurse or the female nurse have to be well known and they can handle those instruments properly. At the same time, it requires a multidisciplinary approach, in the sense it requires other departmental help like blood bank or pain post-op handling of the patient. So in that matter, multidisciplinary approach is definitely required.
Yeah. And in severe complicated cases, do other departments like urologists, then surgeons, are they also required?
Yes. So in the as I said, multidisciplinary, you also require surgeons departments like urologist or surgical gastro, because gynecological surgery we are dealing with uterus, but there are certain organs which are around the uterus, that is the bladder and the bowel. Sometimes in certain conditions they get stuck to each other. So when you are removing the uterus, these organs have to be spared. So while sparing, they may get injury. So whenever they get injury, we may have to take the help of the urologist and the surgical gastroenterologist.
Yeah, so for the best outcome, it is very essential to have a multidisciplinary team. It's not just the surgeon, but a lot of other people also can be involved. Then the outcome will be very good for the woman. Thank you very much, sir, for sharing your valuable insights.
Thank you, madam. Yes, thank you.
So, having the right diagnosis, choosing the right doctor, the right hospital is very important for the good outcome for the woman. You need not have to suffer in silence. The technology has advanced and we are there to help you. At Birthright Rainbow, our goal is not just to perform surgery, but to treat her with compassion so that she can get back to her life as soon as possible. Stay safe, stay informed. Till next time. Thank you.